Good morning, all. Today's our topic is trigeminal ganglia. Now, introduction. This is the sensory ganglion of the fifth cranial nerve. It is homologous with the dorsal nerve root and ganglia of the spinal nerve. All such ganglia are made up of pseudo-unipolar nerve cells with a T-shaped arranges arrangement of their process. The process arises from the cell body, uh, which then divided into the central and peripheral process. Now, this is a figure of superior view of the middle cranial fossa and showing some of the its contents. Now, situations and the meningeal relations. The ganglia lies on the terminal impression on the anterior surface of the petrous temporal bone near its apex. It occupies a special space of durameter called the trigeminal or Michel's clave. There are two layers of the dura, which is the ganglion. Associated roots and branches. The central process of the ganglia cells from the largest sensory root of the trigeminal nerve, which is attached to the pons and its junction with the middle cerebral peduncle. The peripheral process of the ganglion cell from the three divisions of the trigeminal nerve, namely is ophthalmic, maxillary, and mandibular. Now, blood supply. The ganglion is supplied by the internal carotid artery, medial meningeal artery, accessory meningeal arteries, and by the meningeal branches of the ascending pharyngeal artery. Now, clinical anatomy. Intractable facial pain due to the trigeminal neuralgia or carcinomatosis may be abolished by the injecting alcohol into the ganglion, and sometimes cutting of the sensory root is necessary. Congenital cutaneous nevi of the face and map out accurate the area supplied by one or more division of the V cranial nerves. Now, this is the figure of pathway of the fibers from the skin of the face. Now, its relation medially. Medially, we can see the internal carotid artery, posterior part of the cavernous sinus, laterally medial meningeal artery, superiorly peripheral parahippocampal gyrus, inferiorly motor root of the trigeminal nerve. Now, creator petrosal nerve, apex of the petrosal temporal bone, and the foramen lacrum. Now, here the medial meningeal artery. Introduction. The medial meningeal artery is important to the surgeon because this artery is a commonest sources of the extradural hemorrhage. And origin. The artery is a branch of the first part of the maxillary and the given of the infratemporal fossa. The course and the relations in the intratemporal fossa, the artery runs upward and medially deep to the lateral pterygoid muscle. Here it enters the medial cranial fossa through the foramen spinosum, and in the medial cranial fossa, the artery has an extradural course. The frontal anterior branch is larger than the parietal branches, and the parietal or posterior branches runs backward over or near the superior temporal sulcus of the sacrum. Now, its branches. The medial meningeal artery supplied only some branches to the durameter. Within the cranial cavity gives off the ganglion branch, the petrosal branch, superior tympanic branch, temporal branches, and anastomosis branches. The cranial anatomy, the clinical anatomy, the Middle meningeal artery is of the greater surgical importance because can be torn to the head injury, resulting in the extradural hemorrhage. The frontal and anterior branches are commonly involved. The rarely the parietal or posterior branches is applicable, applicated causing an contralateral difference. Other structures in the cranial fossa after removal of brain. The various structures seen in the removal of the brain: 12 cranial nerves, cavernous part of the internal carotid artery, 4 petrosal nerve, and 4 parts of the vertebral artery. Now cranial nerves. The first of the olfactory nerve is seen in front of the 15 to 12 filaments of each side that piercing the cibriform plates of the ethmoid bone. The second or the optical nerve passes through the optic canal. The third is oculomotor, fourth or trochlear nerves piercing the posterior part of the roof of the cavernous sinus. The fifth trigeminal nerve has larger sensory root of the small motor root, and the sixth absent nerve piercing the lower part of the posterior wall of the cavernous sinus. The sixth or facial and eighth or statoacoustic vestibulocochlear nerve passes through the internal acoustic meatus. The ninth glossopharyngeal, 10th vagus, and 11th accessory nerve pierces the dura as the jugular foramen. And there is the glossopharyngeal nerve is close to separate sheath of the dura. And the 12th hypoglossal nerve pierces to the dura separately opposite the hypoglossal canal and passes through it. Now internal carotid artery. The internal carotid artery begins to the neck as the one of the terminal branches of the common carotid artery. Cervical part in the neck, it lies between the carotid sheath. Petrous part with the petrous part of the temporal bone, and cavernous part, the cavernous sinus is part of the artery gives, and cavernous branches to the trigeminal ganglia. The superior and inferior hypoglossal branches to the hypophysis cerebri. Cerebral part, this part is light at the base of brain or emerging from the cavernous sinus. Gives following artery: ophthalmic artery, anterior cerebral artery, middle cerebral artery, posterior communicating artery, and anterior choroidal artery. Here the figure of the various part of the internal carotid artery. And now petrosal nerves. The greater posterior nerve. Here is gustatory and the parasympathetic fibers arise from the geniculate ganglion of the facial nerve. And the nerve is a pterygoid canal, passes through the pterygoid canal, reach to the pterygotemporine ganglion. The deep postrosal nerve sympathetic is now it is a branches of the sympathetic plexus around the internal carotid artery. The lesser trosal nerve parasympathetic in the nature is branches of the tympanic plexus and derived from the preganglionic parasympathetic fibers. And for the external petrosal nerve sympathetic in nature in the inconstant branches from the sympathetic plexus. The fourth part of the vertebral artery, it enters the posterior cranial fossa through the foramen magnum and piercing the dura. Here the now our new topic is content of the orbit. Its introduction. The orbits are bony cavities lodging in the eyeballs and the extracellular ocular muscles, nerves, blood vessels, and lacrimal gland. Out of 12 pairs of the cranial nerves, 2, 3, 4, 6, a part of 5, and some sympathetic fibers are dedicated to the contents of the orbit only. Now the features of the orbit. The orbit are pyramidal cavity situated one on each side of the root of the nose. They provide sockets for the rotatory movement of the eyeball. The long axis of the each orbit passes backwards and medially. The middle wall are parallel to each other at a dense distance of 2.5 centimeter. The lateral wall are sets and it contains eyeball. Eyeball occupies anterior or one third or orbit, and fascia orbital and bulbar. Muscles extraocular and intraocular. Vessels ophthalmic artery, superior and inferior ophthalmic artery, and nerves optic, ocular, ocular, abduction branches. And the grammar gland, it is already studied in the chapter 2. And orbital fat. Now visual axis and orbital axis. Axis passes through the central or anteroposterior poles of the eyeball is known as a visual axis. Orbital fascia or the periorbital it forms the periosternum of the bony orbit due to the loose contents to bone. It can be easily stepped posteriorly. It is continuous with the dura mater and with the seat of the optic nerve. This is gap in a periorbital or the inferior orbital fissure. This gap is bridged by the connective tissue. At the upper and lower margin of the orbit, the process of the fascia hold the fibrous pulley of the tendon, and the entire process forms the lacrimal fascia. Facial sheath of the eyeball or bulbar fascia. The Tenon's capsule forms a thin, loose membranous sheath around the eyeball, extending from the optic. Now, this is the figure of the orbital fascia and facial sheath. The sheath is pierces the tendons of the various extraocular muscles and ciliary vessels and the nerves. The sheath gives off a number of the extension uh, tubular sheath and medial check ligament, lateral check ligament. The lower part of the tenon capsule thickens. The name is sensory ligament of the eyes and the sensory ligament of the loquats.